For media who are on the call, we will have a video and a transcript available. Once that video and transcript are completed processing, we will send an email around to everyone who's registered with the link to get that information. If you have not registered, if you've just clicked on a link to today's event from an invite that we sent out, but you didn't register and you'd like to get that transcript and video, let us know that you want to be on that list. Just send us an email to info@newswise.com and our team will add you to the list to make sure that you get those materials once they're done. We're going to try something new today too as well that I want to just make a quick note about. Since this topic with reopening sports, both pro and student sports, we want to take a quick poll of the audience about that. And so in just a few minutes, I'm going to make a poll live with just a single question, and I'll explain that as we go along. And we want to get your feedback about that question. And then perhaps maybe we could do it a second time at the end of the event and see if anybody's changed their mind. Okay, I just want to give another few seconds in case anyone's running late to click the link and get logged into the meeting, and a few final instructions. If you're in the media, please, if you would rename yourself so that we can identify first name and last name and your media outlet. And to do that, just hover over the menu in your own window and click on the link that says rename, put your first name, last name, media outlet. You can also find your own name under the participants list, and there's a menu there to edit things like your name on that page. Take note of the chat, and we will take questions from media through the chat. So I'm going to just type a real quick message here. When you chat your question to us, also, if you could, let us know which panelist you want to ask the question to, and let us know if you are interested in asking the question yourself. If not, I can certainly ask the question for you, but we want to give media the opportunity to interact with our panelists directly and ask those questions. Welcome to this Newswise Live expert panel. I'm your moderator here at Newswise, Tom Canalicchio. We have with us 4 experts to talk about reopening sports. I will introduce each of the panelists real quick, and we'll get straight into questions. So first, I want to tell you, we have Dr. Lisa Delpy Neirotti. She's the director of the MS in Sports Management program, as well as an associate professor of sports management at George Washington University School of Business. Thank you, Dr. Neirotti. We also have David Pierce. He's an associate professor and the director of Sports Innovation Institute at Indiana University. Thank you, Dr. Pierce.
Thanks.
We also have Jayson Kratoville. He's the interim director of the National Center for Security and Preparedness at University of Albany. And last but not least, we have Dr. Lee Kaplan, and he's the chief of the UHealth Division of Sports Medicine and director of the University of Miami Sports Medicine Institute. Thank you very much, Dr. Kaplan. We'll get straight into some questions. And first for Dr. Kaplan, are professional and college sports concerns about COVID generally the same? Are they aligned, or what differences might there be between dealing with reopening pro sports and continuing sports at the college level?
I think the general concern about playing in competition and whether you're going to pick up exposure to COVID-19 is ubiquitous among it, but each of these are very different. In fact, even in the pro sports, they're different. So at the University of Miami, there are a lot of rules with the college athletes in terms of what they're doing. There's a high level of exposure of college students just being in the dorms and their living conditions. And then we have limited facilities with 500 plus athletes at the University of Miami. Some schools like Florida and Wisconsin may have 800 to 1,000 athletes. Whereas, for instance, I was talking to an NBA player today, and the whole idea that they're going to go to Orlando, they're much more restricted in terms of who they're going to be around than somebody that's in college, and their comings and goings. Baseball, we take care of the Miami Marlins, and in baseball, Although the team may be limited, they are going to live in their own homes, they're going to travel. So each of them are a little unique based on sport. And then, Jayson could probably comment on the federal and the security kind of side of it from a health security. I think one of the things that's going to change, Tom, is that we're going to call security is also going to have a public health component moving forward. And if you look at what Dr. Fauci said this morning that was published in ESPN, he doesn't think we're going to be able to play football unless we're in a bubble. That's impossible in college sports.
The logistics certainly are a concern. For Dr. Pierce, you conducted a survey and you got many thousands of responses from all across the country about youth sports programs. What from those responses can you tell us were the most important things to parents and athletes in their responses?
Yeah, so we had over 10,000 responses from 45 states, parents of people competing in youth sport, both on the travel and on the recreation side. And one of the top results was anything related to sanitization of high touch areas, and then also the playing areas and equipment. Those were both things that the more people experienced of those, the more satisfied they were with kind of this new user experience in the COVID era, so to speak. We also had some other, and they were also willing to pay for it as well. Most of them indicated a willingness to pay increased fees to cover that, and that is a significant deal, especially on the recreational sports side of things for your local rec programs. I just saw a note from someone locally here in Indianapolis that the bill was going to be $45,000 just to cover the fall season, and so that's difficult for these smaller nonprofit organizations to absorb. The other things that kind of fit into the must-be category. So these are the things that don't necessarily get people excited to be enduring them, but if they're not there, they become dissatisfied. And that is limiting the personal contact between athletes. So those are your 3 H's: the handshakes, the high fives, and the hugs. Another one was limiting admission to those who are under 65 and have no conditions. So that's kind of the for this period of time, kind of the no grandparents rule, so to speak, at youth sporting events. Social distancing, and seeing that visible, and then respecting those who are trying to enforce it. That was in the must-be category. And then the final one, which I actually thought was surprising, was their people's willingness and to complete some sort of a health screening to gain admission. And so on the travel sports side, that's also reporting in where you're staying, your contact information, as we get into those like contact tracing issues, in addition to answering questions about your health. The one thing that people did not want to see, we used something called the Kano model to classify these different adaptations. The thing that people did not want to see was eliminating spectators completely. So in other words, sending your kid in to only go compete and not being able to follow along. So that's kind of the high level results that we had in our study in the youth sports space.
Thank you, Dr. Pierce. To Dr. Neirotti, from the management perspective, how should and how are league officials, as well as school administrators or the people who run companies that do youth sport programs, how are they weighing the risks of spreading COVID with the possible benefits to the business, the community, their school? How does a good manager, tackle looking at those two columns, the pros and the cons?
Right. I mean, it really is about risk and rewards. And, on the risk side, you could take all the precautions that you could possibly think of, yet you have, just a handful of students may go out to a nightclub or go someplace and contract COVID, bring it back without even knowing, and then it's rampant. And so, that's the big, what if. And there's some sports on the sports side, there's some sports that may be able to be controlled more than other. Football has 60 to 100 people when you start counting in all the trainers and coaches. And that's a large number of people to continually test and monitor and make sure that they don't socialize with other people outside of the, safe circle. And so that's where you could find football having difficulties, unlike basketball has a smaller, safe circle.
Thank you, Dr. Neirotti. Now, I want to open this poll question, and I'm going to ask Dr. Kratoville to answer this question while we get responses from the audience. So The poll question we'd love everyone to respond to. I'm launching that, so I believe everyone should see a pop-up. Is it fair for parents to send their kids to play sports, even if that raises their community's risk of spreading COVID? Dr. Kratoville or Professor Kratoville, what would you say to that?
So yeah, I think a lot of times we frame this question in terms of how does this impact my safety and the safety of the people around me? And I do think that is the first question. But where I think we need to get people thinking is that, and Dr. Neirotti alluded to this a little bit, the most powerful group of people in determining how this virus is going to spread and what its impact on our public health and economy is going to be are individuals, our citizens, and empowering them with information to know if you engage in these high risk activities, you are increasing the likelihood of a negative public health outcome, and you are increasing the likelihood of a negative economic outcome. But more importantly, if you abstain from these, if you take this action, if you make this sacrifice, you actually are increasing the likelihood that we're going to get back faster and increasing the likelihood that we can engage in organized sports in the long term without a bunch of fits and starts. So, and I think that latter framing, that less scolding framing, is going to be the important way to cover this going forward. This is the proactive approach that you can take to control how this is going to go, or at least help control how this is going to go for your community and your family.
Thank you, Jayson. Let me just mute your audio because we just get a little bit of loop back on that. The poll stopped after only a few responses, so I just wanted to relaunch that. Please do give us your responses to that question, and I want to open this up to the other panelists as well. Dr. Neirotti, what do you think about this question? Is it fair for reopening sports programs if that's going to raise the community risk of COVID?
Well, I must say my son started playing on Sunday in a lacrosse club team, and they have all the safety precautions in place. My son did say they spaced out. They were only doing passes. They were only doing drills, more fitness activities, but they plan to go to a tournament, 3 of them, later this summer. And I'm still curious how that's going to work, because that would be full contact. They're saying they're doing, shorter games, but I'm still saying you're contacting other people. So they have not given further guidance.
It's such a tough call. Dr. Pierce, what do you think about this question?
Well, I mean, I think there's a lot of benefits to participating in sports. So if we're talking about, weighing the advantages and disadvantages, there's tons of research over the last 30 years and a lot of advocacy around, the power and the influence that youth sport has on kids. And right now, just, like Dr. Neirotti, I've got a son who is going to play baseball, and it was really the only summer activity that we were going to engage in, and our town decided to cancel it while a lot of the other ones are still competing. And it's when there's no school and nothing, I mean, there are socialization things, that kids are missing out on, in addition to the physical activity and those sorts of things. So, it is I guess really it's anything we go out and do in public, you could put, framed in that same question, to take a trip 2 hours away, to go to the gas station to get a pop. I mean, it's like, there's lots of things that people can engage in that you could probably put in that same question.
So what I think I hear in your answer, Dr. Pierce, is if you're going to take this risk of participating in sports, you should be really extra careful about all the other risks that you may be taking. Is that a fair thing to ask?
Yeah, I mean, I think it participating in youth sport would fit in the classification of a variety of other, entertainment and recreation things that we would do at this time.
Dr. Kaplan, what do you think of this question? Is it fair for parents to send their kids to play sports if that's going to raise risk of spreading COVID?
I'm glad David and Lisa spoke before me. I have to tell you, from a statistical perspective, which we do a lot of here, it's a very loaded question, right? And the reality, and Jayson will tell you, if you go outside, you're at risk, right? I think minimizing the risk is critical. Allowing people to do things, but I really have to tell you, and I don't know how old David's child is, but having 2 teenagers, The kids cooped up is a major issue. Fortunately, my children don't have mental health issues, but we're hearing more and more of how these triggers are there. So although COVID is a problem, I mean, Tom, one of the things we talked about the other day are the multitude of other disease processes that have just rapidly advanced because of COVID. We have a history of this, and I'm going to just take 1 second on this. You know, after the crash of 2008, the markets crashed. There was a rebound effect of many chronic diseases, diabetes, cardiac diseases, some neurologic diseases, because people didn't seek care because they didn't have the right insurance. And so it's the number of people that are going to study this event, both on a you know what I would call a natural, looking at the air quality and everything else. But for instance, we were watching the news one night, and one of the, and I apologize, I don't know which university, I think it was the University of Birmingham in England. The dean of the med school was speaking, he's an oncologist, and he said the National Health Service in England gets 30,000 new cases of cancer a month. And in April, they got 5,000. Well, we know, yes, we have incredible costs in medical care, et cetera here, but we know that when you compare us against a socialized system that takes longer to treatment on certain oncologic diseases, we fare better, right? Because we get people to treatment faster. The number of people who died of cardiac and stroke issues at home without seeking treatment, much higher. So, you know, I think the question is that if the kids go out, they're going to get everybody sick. I don't think that's really proven. I think if the kids are using the appropriate situations, their parents are, you know, there's a higher risk probably if they go out and get pizza afterwards and they're laughing and carrying on than playing baseball or lacrosse. So I think we're going to have to do some risk stratification. People like Jayson can tell us, look, this is the real risk, but your question is a little too jaded.
Very fair enough. We want to get an honest response from all of you, so we wanted to pose it in those kinds of terms. I'll go ahead and end the poll. We got 8 responses from our audience. A few people still didn't respond, but and sharing the results with everyone, 7 out of the 8 said no to this question. So I do think that there is some concern, but all of your responses have maybe mitigated that concern a little bit. But Dr. Kaplan, since you mentioned examples such as the increases in stroke and heart attack death because people are not seeking emergency help, or the cases of cancer being detected plummeting, and maybe people need to be going in to get checked for things like that. These are some of the consequences of the pandemic. And I want to ask of Jayson, with this potential second wave kind of creeping, or even if just, I don't even know how to describe a second wave if we never really fully dropped far enough to begin with, does that kind of stop and start that might be part of this? From your background in emergency preparedness and those kinds of things, how does that affect both the long-term economic recovery, but also some of the factors like Dr. Kaplan mentioned, people not going to the hospital when they maybe have an emergency medical situation because they're concerned? Does a stop and start process, if we had to shut things down again in another few weeks or months, what would that have in terms of an impact in those areas?
So I think one of the first things you're hearing from everyone is the broad complexity of this issue, that it's not just one issue, one virus, one thing, and that the risk equation is incredibly diverse. But what I would liken this to is if this were a human enemy that we were facing, we would liken this to siege tactics, where we're basically under siege right now. And what happens over time is that people become a little bit more risk tolerant of that threat as they start to feel the very real impacts of being under siege, of not having access to certain things, and the cascading impacts of that. And then the second piece is there's also, it becomes this sort of sentiment that maybe the threat wasn't that bad to begin with, you know, especially in contrast to, you know, what we're feeling now. And so I think what we need to do is empower people to realize that what our experts tell us is if you look historically at pandemics, the second waves hit pretty strongly for those reasons. So you end up you end up with a situation where people just kind of get, for lack of a better term, tired of, and I mean that in the most empathetic way. People need jobs, people need their businesses to flourish. They lose some of the resilience to holding out, and they sort of go out. And so I think that the issue becomes, if we open things too soon, that there is the risk that the next time we try to open, if we shut back down, the next time we try to open, it's going to be felt like we cried wolf the first time in trying to get stuff reopened, and it's going to be more sluggish of a start. But the question of what is too soon is an incredibly complex question.
Incredibly complex. Dr. Pierce, you told us a lot about the results to the survey, and I want to dig in particular into some of the things that involve what lengths parents and families are willing to go to. You mentioned some of the things like added costs for cleaning. Can you tell us some more about that? What inconveniences are they willing to bear, or is there some resistance to bearing certain inconveniences?
Yeah, I think by and large, the big result is people, realizing there's going to be some level of inconvenience. So, three things, other adaptations that really fit this question really well, were just the realization that, hey, we're probably going to have to limit amenities, right? So the locker rooms probably aren't going to be open, the concession stands are closed. So it's like, hey, what if that happens? It's something I can deal with. Another one was, altering your arrival and departure routines, right? So maybe we've got to come fully dressed because we can't use the locker room. In a travel situation, maybe typically we've hung around to watch the next game, to watch our friend play, or to see how that team we're going to play next is. We can kind of scout them a little bit, and maybe we can't do that right now. So those are and then also kind of changing your social distancing of your dugouts and your benches and all that. Those are all things that showed up in our study as things that people are realizing are going to have to be a bit of an inconvenience, but at the end of the day, they're reporting it's not going to impact their satisfaction or their experience or their willingness to engage in it.
Thanks, Dr. Pierce. Dr. Neirotti, when it comes to trying to mitigate these risks, the plan may be what the plan is, but in practice, things may break down. And if that's the case, are we setting up sports teams to potentially, and their staff and all the other people around them, are they potentially kind of a canary in the coal mine here and could potentially become a new hotspot if things do break down and a lot of these detailed plans start to break down and aren't followed closely?
As we all know, commercial interests are pushing both universities and professional college and youth sports to going back. I'm still having to pay the same amount that I was paying pre-COVID for the youth lacrosse team. But, in terms of, these commercial interests, as we've heard, you bring kids back, you want them to be in the dorms, you want them to buy the food in the cafeteria. Those are all economic drivers. And the same thing on the sports side, though, I think the biggest piece of the pie in money is broadcast rights. So as long as they can at professional level, if you have field of play with no spectators, at least they can have broadcast feed that the majority of people who follow teams watch it on the media anyway. So even for psychological reasons and then the commercial reasons, I think having sports without spectators is the best way to go there. If you can control it again, football is going to be more difficult. I was really surprised by Dr. Pierce when he said, I believe, that parents wanted to come in, that they felt that spectators should be allowed. I think for, again, the emotional reasons, I just want my son to be able to play. And I am fine, and I think parents should be fine to back off if that's what's going to make it safer for everybody.
Thank you, Dr. Neirotti. We have a question from one of our media on the call, Josh Moore from the Lexington Herald Reader. Josh, go ahead with your question.
Hey, everybody. Thanks for doing this. My question is specifically for Dr. Kaplan. You look at the pro athletes and they have, they have unions that can collectively bargain for them, and they've kind of worked out these deals and everybody kind of has their own plans. But what rights do college athletes and coaches and staff members have in terms of, like if they say they choose not to participate at all, if college football were to happen, would that cost him scholarship money, and would that be okay for schools to say that can't happen, or would the NCAA have to consider giving those students who choose to sit out because of a pandemic the option to come back and have another year of eligibility? And kind of on top of that, what is the obligation to other schools to know what positive cases or negative cases, like whatever the situation is, between institutions? Like if Florida and Florida State were to play one another, like what should they be obligated to give to one another information wise? And if nothing, then should that be something that there needs to be considerations made for?
Thank you, Josh. Dr. Kaplan?
You asked a number of good questions, and clearly I find it fascinating that you use college football, because I know in Lexington that's just the warm-up for the real sport in town, Coach Calipari's team. Let me start at the end. So we have an outstanding athletic director at the University of Miami, and Blake James, who was the head of all the athletic directors the last few years for the NCAA in their group. These schools are actually going to have a way that they're going. I don't know about telling which players have it. Obviously, there's really a moral and a health obligation not to play anybody that's sick, right? But you are going to be able to put some amount of circularity around what the rules are for each team. So, for instance, one of our away games early in the season is Michigan State. We're going to know exactly what Michigan State's doing, and Michigan State's going to know what the University of Miami's doing. The question you asked about the union is a fascinating one. Today, I was told by this agent that the NBA players have till June 24th to tell if they're going to play. I don't know if that's right or it has more to do with who's on the list. You guys would know better than I. The college players, a couple things happen. One, a high level of communication. The second is, and you've seen because of the social issues going on right now, that college players have a lot of voice, right? They're getting buildings names changed. They're pulling down statues. So I think that's great in terms of if they have concerns. We've tried to educate. Ohio State actually had them sign a pledge because they wanted them to know what was being done for them and what they needed to do. Because this is the new concussion, right, Josh? And that kids say, well, I don't really feel that bad. I'm not going to tell them that I don't feel well, right? So, but most of the larger schools, because there's a tremendous cost here, will be putting weekly testing. If a player doesn't want to play because of COVID, they won't lose their scholarship, at least at the University of Miami. We've already spoken about that. If they're not comfortable playing or with the conditions, they don't have to. And then our spring sports, at the beginning of the baseball season, we had the #1 baseball team in the country. And I think we were number 5 when this all shut down. Those guys all got more eligibility because of the season. So that happened. But you guys could write for a decade on how this messed other athletes up, right? I think it was Cornell University had the #1 men's, women, and men's hockey team already in the playoffs, and there's no college hockey. I was at the University of Wisconsin for 6 years. We won 3 national championships between the men and the women. That would have been a humongous disappointment for those athletes. So I think that the college players don't have a union, but their voices. I'll tell you where we're worried. We're worried because college sports, the lifestyle recruiting and everything else, and many of the college coaches, especially the elite basketball and football coaches, are definitively above 60, if not 65, many in their 70s. And with comorbidities, which people may or may not know about. So now what do we do, right? Because Texas, I think today said 14 kids tested positive. So I think you have to take the same health precautions around those coaches as you would anybody else.
Thank you, Dr. Kaplan, and thank you for your question, Josh. I want to go to Dr. Pierce since Josh's question brought up, what are the liabilities of sharing? Okay, this team had someone test positive. They're sitting out this game, but they may have been in contact with other players, and that kind of thing might be a risk. So Dr. Pierce, who takes responsibility if a youth league were to emerge as a new hotspot for spreading infections? And what kind of thoughts are there about how many cases before deciding to shut things down and halting future events?
Yeah, definitely a interesting question. So kind of the first line of defense is that if we're talking in the travel sports world, it is definitely the attitudes of the coaches and the team moms on how they're really going to try to follow all these different guidelines, right? But then the event owners and the event operators really become the ones, I think, with the decision-making power to cancel events. So that the venues themselves, like here in Westfield, Indiana, we've got Grand Park, the 400-acre largest youth sports complex in the country. I talked with them this morning, and their point was our events are so short in the timeline, it's unlikely that someone is going to, you're going to have enough time to realize someone has contracted it, and then there's a large enough number of people to shut down an event. So if we're talking about youth travel events that are in that 3 to 4 day kind of window, really the decision making really needs to come from the event operators and the owners, and then clearly working with someone of the health department. And I would let the medical folks speak to the the number or the percentages of kids that would need to come up with it. I don't feel qualified to answer that question, but I think really it's at the event owner and operator level where key decisions have to be made.
Thank you, Dr. Pierce, and bless you, Dr. Kaplan. Dr. Neirotti, you mentioned the size of the pro sports industry and concerns of, for example, revenue for universities, obviously being factors. We can't ignore that. With pro sports, you mentioned it's a $500 billion industry. Does that really have a positive net effect on their communities, or is this just big corporations passing money back and forth and the people get to watch, but is money really filtering down into the communities in a way that makes it have a significant positive impact?
Well, there's a couple things there. One is it does make an impact when you start thinking about the ushers, the ticket takers, the concessionaires who are making the food and using catering companies, the local hotels that host the teams that travel in, the transportation companies that provide the buses. So yes, there's big dollars between media, the media companies, but there's a huge ripple effect down into the local economy just around events, hosting the games. And then you look at youth sports, and that's a $19 billion industry unto itself. And again, it's the ripple effect there as well. I mean, just, I travel to a different county and I go to, a fast food place with my kids instead of coming home and eating. So that's just I'm bringing money into a different economy.
Great, thanks for those points, Dr. Neirotti. We have a question from Randy Lefko of Clay Today Sports in Florida. So Randy asks, in small North Florida county where he lives, youth football and Pop Warner came out and restarted first, and high school sports starting again shortly after. It seems illogical that with high schools being more restrictive, that the youth sports were going full on. Is there a disconnect here to having a consistent protocol? Any of our panel like to tackle that question?
Yeah, I'd be
Dr.
happy.
Neirotti, please.
It's really just about public versus private. I mean, private companies can take more risk because they have, less risk to take. I guess, I had to sign a waiver for my son. There's fewer people